Good afternoon and welcome to the COVID-19 update here on Channels Television. It is a 30-minute daily update of the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, here are some of the highlights. Today, NCDC gets more aggressive in the fight against COVID-19, screens more suspected cases as 35 persons are discharged after successful treatment. And it is World Health Day. Its Presidential Task Force on COVID-19 pandemic visits Lagos State. Plus, Morocco goes tough on citizens who refuse to wear face masks, recommends prison sentence. Now, a total of 35 people have fully recovered from the coronavirus pandemic in Nigeria. Sounds like some good news. The latest were 2 female patients who tested negative twice and have been discharged from the infectious disease hospital Yaba yesterday. Now, even though the numbers continue to climb, the National Center for Disease Control confirmed the 6 new cases as at Monday. 2 of the cases in Kwara, 2 in Edo, and 1 each in Rivers and the Federal Capital Territory. The total number of cases recorded in the country is now 238. The Lagos State government, in the meantime, is calling on citizens not to stigmatize the discharged patients, but to support them to get over the experience. Here's a breakdown of the cases in each of the states, showing that Lagos now has 120, FCT Abuja 48, Osun 20, Edo has 11 cases, Oyo 9, Bauchi has 6 cases, Akwa Ibom and Kaduna 5 each, 4 in Ogun State, while Enugu, Ekiti, Kwara and Rivers each have 2 cases, with Ondo and Benue states recording 1 case each. Now, we understand that the Presidential Task Force on COVID pandemic is in Nigeria, is in Lagos on a fact-finding mission. We'll be talking to our correspondent, Mary Alalo Yusuf, who is monitoring that visit for us a little later on. But let's tell you that this day, April the 7th, as far back as 1950, the World Health Organization observes the day as World Health Day, with the contribution of doctors, nurses, and other healthcare workers acknowledged on this day. And at a time when the whole world is facing a health crisis and the coronavirus pandemic, healthcare professionals are set to be the frontline soldiers in this war. This year's World Health Day carries more importance than ever. This year's theme, Support Nurses and Midwives, is to generate attention towards their contribution in the COVID-19 outbreak. The day is also to highlight the current status of nursing around the world. Let's go over to Edo State, where beginning from today, it will be an offense not to wear the face mask in the state, and anyone who flouts the directive will be prosecuted. The Deputy Governor of the state, Mr. Philip Schreiber, at a press conference in Benin City, also ordered the closure of all markets and the relocation of food markets to schools and some designated centers.
And bring it home. For us to stop all markets in Edo State are to be shut down, effect from Tuesday, 12 midnight. And the state government will be taking advantage of the closure of the market to start fumigation from Wednesday, 8 April this month. And the market are to be relocated to designated public primary schools and secondary schools within the market vicinity. The purpose is we approve that foodstuffs and other essential commodity are the only one allowed to be to operate in Edo State. The government also has mandated the use of face masks, as government will sanction and prosecute anybody that is not adhering to this directive.
Well, elsewhere, a state laboratory appears to be in the offing in Bauchi State as government prepares to set up one to cater to COVID-19 patients. At the moment, all blood samples collected are taken to the Federal Capital Territory, and the state does not see it as convenient. Here's our correspondent, Hajara Aliyu, with more.
The Nigeria Center for Disease Control has not listed Bauchi State as one of the states that would have a laboratory for the detection of COVID-19. But the Bauchi State government is looking at the possibility of establishing one. This will speed up the confirmation of new cases of COVID-19, and then it will ease the burden of transporting these samples every time to Abuja. It may also reduce the burden on the central testing laboratory. At the weekend, the number of COVID-19 cases jumped to 6 in Bauchi State, and so far, over 300 contacts have been listed for tracing. We understand that not all these contacts will be tested for the virus. Some of them will be monitored closely to see if they develop any symptoms of COVID-19. But don't forget that there are reports of asymptomatic carriers. State Deputy Governor has been speaking about the health status of the Governor of Bauchi State. Contrary to online reports that the Governor has tested negative, the Deputy Governor says no confirmation has been received yet from the Nigeria Center for Disease Control.
He's doing fantastic. You know, it's exactly 2 weeks now since he went into self-isolation. And like she said, the protocol is for sample to be taken. And we have taken the sample and we are waiting for results from the NCDC. And like you know, unless the result comes in from the NCDC, as government, we will not make a comment on it.
Residents of Bauchi State are eager to see that state that the governor will make his first appearance after being in isolation for over 2 weeks. More donations have been coming to the Bauchi State government to help the fight against COVID-19. The recent one is from a non-governmental organization known as FacePalm. They made a cash donation of 2.5 million naira in addition to food items that would serve as palliatives. From Bauchi State, Hajara Aliu, Channels Television.
Let's talk about some of the measures to curbing COVID-19 around the world. We have Dr. Obinna Aligwekwe. He is a registrar, Emergency Department in London. He joins us via Skype. Thank you for joining us on the program. First, a lot of people want to know what's really happening, the latest with regard to the health status of British Prime Minister Boris Johnson. What are you hearing?
Good evening, everyone. Thank you for having me on this show. We all know how COVID-19 all started. And from what I think, from my latest information, Boris Johnson, who happens to be the Prime Minister of my home country, is about the first world leader who is to be hospitalized in intensive care. How do I start? He is reported to be stable the last time the world was updated about his status, and we are hopeful that he will recover fully. It is unfortunate that he had to go into intensive care. That puts him among a minority of patients who actually need hospital intervention after post-infection. But I think the world generally and we in the NHS are optimistic and hopeful that he will pull through.
Perhaps as well, Dr. Aligwekwe, many people are wondering the kind of treatments patients are getting in the UK, and how, something mild quickly turns into something that is severe. And people are wondering, what has the immune system and COVID-19? How does it appear that it attacks each person differently?
Well, the thing is, this is a virus which started its problem in December, which is just about 3 months ago. There is still a lot that is not known about this virus. Figures and data change considerably with each passing time. Now, all I can say is this. As we speak, the virus has a 5% mortality rate globally. Currently, about 1.2 million people are infected. Now, what seems to be strong evidence is the virus has a capacity to make this category of people more ill than the rest of the population. The elderly, basically those who are above 70 years, B, those who have pre-existing medical conditions regardless of age. By pre-existing medical conditions, I'm talking about the disease like diabetes, asthma, other pulmonary diseases, immune suppressions, organ transplant. The list is a very long one. But basically, once you have a strong pre-existing medical condition, regardless of your age, you are regarded as vulnerable. And these groups of people are those that constitute the greatest number of hospital admissions and, unfortunately, also fatalities. Now, the virus has been known to affect even healthy people without any previous medical condition as young as 18. In fact, last week, a 13-year-old boy in United Kingdom who had no pre-existing medical condition was reported to have died. In the hospital where I worked in, a 40-year-old who was previously fit had also passed away. So, but in the 4 months that this virus has been on, this is what is the general trend. What that means is that luckily, the vast majority of people will actually survive this virus. As it is right now, it has a 5% mortality rate. What that means is 95% of people are surviving. It used to be much lower. But we think it's because of the percentage of elderly populations in countries that have a high number of elderly people. For example, Italy and Spain. So that's why it has it seems the mortality rate is increasing. But if you correct the figures for age, you find that it is actually much lower in those who are less than 60 years.
Right, so there is some hope coming from the UK.
Pardon?
There is a lot of optimism and hope that, we'll see a plateau of this disease in the UK and elsewhere.
Yes, going by the history of other pandemics, right? Starting from the bubonic plague, which started in the early 14th century, pandemics basically just come and they go. So the aim of every government is to make sure that they flatten the curve soon enough to reduce mortality.
Dr. Obinna, we will talk to you a little later on this. We'd like to appreciate you, Dr. Obinna Ligekwe, Registrar, Emergency Department in London. Thank you for joining us. Well, let's go over to our correspondent, Mary Aledo Yusuf. We told you the Presidential Task Force is in Lagos, and let's find out indeed what's happening. Mary, do we have you? What do we know about the visit today?
Hello, Millicent. It's been a whirlwind of activities here. What appears to be a surprise visit by the Presidential Task Force on COVID-19 turned out to be a sort of a tour of isolation centers about Lagos. We've been to the Onikon Isolation Center. We've been to the IDH, that's the Infectious Diseases Hospital at Yaba. And right now we are at Luth. This tour is going to continue with a visit to Bagada, and perhaps later on in the day a visit to the governor himself, where they will compare notes and talk about the management of COVID-19 in Lagos, which seems to be shaping up to be an example for other states to follow. Millicent?
All right, thank you, Mary. We'll catch up with you. Do stay safe while you're out there. Still to come on the COVID-19 update. We have more on the state government's efforts to curbing the pandemic and also the latest figures coming in from around the world. Please join us again. Welcome back to the program. We take you to Delta State, where to cushion the effect of the lockdown on the state due to the COVID-19 pandemic, the state government, they've ordered the establishment of a food bank in the state. The food bank is expected to take care of the immediate needs of the people while the lockdown lasts. The government has also directed the forfeiture of 1 month's subvention for the offices of all political appointees as a palliative to the people. The State Commissioner for Information, Mr. Charles Anyago, told journalists in Asaba that the situation calls for a lot of sacrifice, and he asked Deltans to be patient and stay safe. The market hours will be from 8 a.m. to 2 p.m., which also applies to petrol stations. Joining us now for more on the rise in cases and also government's interventions is Dr. Adebayo Akintayo. He's a member Association of Medical Officers of Health Nigeria, Lagos chapter. Thank you for joining us on the program.
It's a pleasure.
First, I'd like to ask you the decision by the Edo State government to make it compulsory to wear face masks. Do you think that that is a harsh directive, or you think it's right considering the circumstances?
We have to look at it from a public perspective and again the medical perspective. Judging from the available evidence, scientific evidence, and again the rules and procedures regarding the usage of face mask or medical mask, the medical mask is only recommended for the healthcare workers and for those that are sick. From the public perspective, most people are afraid at the moment, particularly because of misinformation regarding the infectivity and the mode of transmission of this infection. And I think that is what informed the fact that the deputy governor instituted the instruction that everybody should wear a mask. And again, on the basis of the fact that more than 80% of those even who are incubating that virus are asymptomatic. So.
All right, interesting.
But judging from the fact that we have to consider the economic of scales in the usage of mask, that decision may already strain the current problem that the medical personnel are facing in accessing a mask when they actually need it.
That's also where my question is going, saying that this is a day to recognize those working, on the front lines in terms of this pandemic. How do you think they're doing, considering, and that this is situating this to Nigeria now?
Let me put it this way. World Health Day has been instituted several years ago, and the attempt was to bring to the fore the fact that health is the common investment that everybody worldwide must prioritize. But unfortunately, we're not prioritizing investments in health. When we talk of investments, there are basic elements to consider. You're talking of the human capital development. You're talking of the infrastructure, the other resources that will be used, and, of course, a strategic plan.
Do you think the government will learn from what's happening, this pandemic?
Well, let me put it this way. In my own estimation, I think what we are doing now is like a knee-jerk approach. It's not just limited to Nigeria alone, all over the world. We're supposed to have learned from the pandemics that we have had in the previous centuries. Because from the evolution of infectious diseases, pandemics, they have a pattern of spread. If we had learned from the history of the previous pandemics, we would have effectively prepared in terms of developing appropriate human capital capacity for various countries, in terms of instituting the policies and guidelines that will protect people and make people to respond appropriately, be it the medical or the non-medical in events of epidemics. So those structures are not in place. And the institutions are not appropriately empowered. And that is why celebrating the healthcare workers at this moment is crucial. Right. A lot of people will say they are unsung heroes. Yes, but this is the time not just to sing their praises, but to ensure that they are appropriately given the right knowledge, the right resources, and the right tools that will enable them to provide their services without putting themselves in unnecessary danger.
We'd like to appreciate your time, Dr. Adeboye Akintayo, Member Association of Medical Officers of Health Nigeria, Lagos Chapter. Thank you for joining us.
It's a pleasure.
Now, the President of Senate, talking about Senator Ahmed Lawan, he's calling for a review of the strategy used in the Social Investment Program. This charge from the Senate leadership is part of the fallout of an ongoing meeting with the Minister of Humanitarian Affairs, Sadiq Farouk, at the National Assembly today. Senator Lawan further points out that there is a problem with identifying the poor and vulnerable in the society. He strongly insists that the poor have not been reached sufficiently across the country. And as the number of confirmed cases around the world continues to rise, some governments are imposing stricter measures, you've heard from them, to try to slow down the spread. The latest is, however, coming from Morocco. They've made wearing face masks in public obligatory. Any offender will be prosecuted and liable to legal penalties. And in charge of protecting the health of Nigerians, the Nigeria Center for Disease Control's website has all the information and also statistics on the cases across state in the country, with regular updates on COVID-19 regulations and several guidelines as to how to efficiently self-isolate and what it means by social distancing. You can also access emergency contacts as well if you need to. There's also a live update from the World Health Organization each day with regards to how the pandemic looks like, depending on what country you are each moment. It keeps updating us on the number of cases, the number of deaths, and also the recovery efforts across board. You can take a closer look at some of the numbers in real time. And that's our COVID-19 update on Channels Television. You can join us again at 6 p.m. where we have the latest update. Plus, we'd like to hear from you, your staycation at home or social distancing measures. Tweet at us at Channels TV. I'm Millicent Walker. Bye for now.